All right, so now we're going to do part 2 of diarrhea and laxatives. We already went through some of the antidiarrheals, such as the adsorbents and the anticholinergics, the and the opiates. Now we're going to talk about laxatives. Get started here. Okay. So, constipation. What is constipation? It's abnormally infrequent, difficult passage of feces through the lower GI tract. Remember, constipation is not a disease. It's actually a symptom. It's a disorder of movement through the colon and or rectum, and it can be caused by a variety of diseases or drugs, but just remember it's just a symptom of something else. So let's talk about laxatives. There's bulk forming laxatives. That's one class. That's why I think making flashcards would help for this. Bulk forming. These are your examples: Metamucil, Citracel, Fibercon. You can get these over the counter. So what they do is it has the water that's in your intestines absorb into the stool. That increases the bulk. It's really not supposed to cause diarrhea per se, but it's supposed to just bulk it up. You can take this long term. It's basically having fiber. It distends your bowel. It helps with reflux, the peristalsis, your bowel activity. Okay, so those are bulk forming. Metamucil, Citracel, Fibercon. There's Consol. There's other ones, generic ones over the counter. Those are ones that you see here the old people taking every day to help their bowels move regularly, which can actually help. So it can be used long term. You don't have to worry about electrolyte disturbances with these. Now we have emollients. These are softeners and lubricants. So what that does is it promotes more water and fat in the stools. It helps lubricate the material to help it move through. This is your Colace, Surfac. You can get this over the counter again. It's mineral oil is another one. Mineral oil is not used as much anymore. You have to watch. Mineral oil can actually it doesn't work as well as, say, Miralax that's out right now. But anyways, these are over the counter also. Then we have hyperosmotic laxatives. This increases the water content in the fecal material. The result is your bowel becomes distended. It increases peristalsis and evacuation. Now, these things are usually used for pre-surgery, pre-colonoscopy for to check the colon because you want them really emptied out. So this is your polyethylene glycol. That's your Golightly, your PEG. It comes in a big gallon. It's not fun to take. People hate it. You're on the john a lot because it's for clean out. It's not something to be used all the time. Nobody would want to take this all the time. Glycerin, there's glycerin suppositories, which can help, although not given as much anymore, as well as lactulose. Cronolac is another one that you can use. There's some saline laxatives. Again, these are not used as often, but we think this can be used in an enema form, Fleet's enema. We used to give enemas in the hospital that were saline, that probably are still given, but this increases the pressure in the intestinal tract. It causes more water to enter the intestines because remember it's saline, so it's causing that fluid shift. And so again, it distends your bowel, increases the peristalsis, and hopefully you can evacuate out the stool that's stuck there. So there's milk of magnesium, mag citrate, the Fleet's phosphosoda, the Fleet's enema, and Epsom salts. I don't see Epsom salts really used. Milk of mag, obviously, you can get that over the counter. Mag citrate used to be used as a colonoscopy prep, but has been shown you have to be very careful of people with kidney disease, and it just started causing problems, so now they give that big gallon jug again. Then we have some stimulants. That's your Senecot, castor oil, oh fun. Cascara. There's been this old wives' tale that you take castor oil at the end of your pregnancy to bring on contractions. So anyways, this increases peristalsis via the intestinal nerve stimulation. So that stuff you can get over the counter. All right, so I put this into a table. So you have a laxative group here, which I put them into different categories. So the bulk forming, which is your Metamucil, your Citrusel, and your Fibercon. Can be used for acute constipation, chronic constipation, irritable bowel syndrome, diverticulosis and itis. This is the only one that you can use with diverticulosis and itis. You do not use it with anything else. This can be taken daily and long term. It's safe. It won't cause diarrhea. Make sure with these you're taking with a full glass of water, because remember, it's fiber. And so you really need to take it with a glass of water. Otherwise, you're going to get so bloated. If people are just starting this medication, it can also cause bloating that can be uncomfortable. So if you're never taken any of this stuff before, you might want to start with a quarter of the dose or half the dose. It's usually in powder form. Some come in little tablets, but it's powder for the most part. They come in different flavors or plain. You can just put in water. Emollients. Those are your stool softeners. Those are good for, again, acute and chronic constipation. These are really good for post-op constipation if you're taking narcotics. So remember that, hint, hint. Colace would be a good choice. Softens a fecal impaction, facilitation of BMs and anorectal conditions. So if somebody's really constipated, if someone's truly constipated severely, you'll have to do a combination of enemas and oral medications to help soften that up from the bottom and from the top. Saline, which is your mag sulfate, milk mag, mag citrate, and your Fleet's enema. These are usually for diagnostic surgical preps, sometimes removal of parasites. I luckily have not had to work with that. These can cause electrolyte imbalances, as I mentioned earlier. It's not used as much for colonoscopies, but when you think of Fleet's enemas, a lot of pre-surgical prep will include a Fleet enema, say hysterectomies, because they just want to make sure you're cleaned out as much as possible, although you don't have to be completely, but it will help. The last thing you want is to have a hysterectomy or any bowel type surgery or female organ type surgery, and then develop constipation post-op. You're having pain down there and you don't want to be straining. That's not fun. The hyperosmotic is for your diagnostic surgical preps, like, for example, colonoscopy. That's your go lightly. As well as chronic constipation, it can be used for your lactulose glycerin, that kind of thing. Your laxative group, your Senecot, Cascara, which is rarely used, castor oil is rarely used, but this can be also used for surgical prep. They may have you take some Senecot the day before surgery with the Fleet's enema the morning of or the night before. There's just different types of instructions. So what are some side effects? So side effects to the Metamucil, Citrusel, Fibercon. It can cause some impaction, although it's very safe. It's rare that it would cause infection, but just know that if someone tells you, you know what, I've been taking this every day and I haven't had a bowel movement in 3 days, you always need to suspect the worst. What's the worst? Obstruction. So you want to check for bowel sounds. You want to let the provider know. You don't want to give any other medicine. You don't want to tell them to do anything until you exclude or rule out an impaction. If someone's having a normal BM, then hasn't had one in 2 to 3 days, that's not normal. Also, it can cause fluid overload, although really, really rare. Emollients, they can cause some skin rashes, sometimes decrease absorption of vitamins. But again, remember, these aren't supposed to be used for long term, except for these can. None of the other ones should be used long term. This can cause abdominal bloating, which would make sense because it's actually bloating the abdomen to increase peristalsis to get the stool out. Some rectal irritation for sure from that chronic diarrhea, because if you're taking Go Lightly, you'll be on the john. Saline, you can have some magnesium toxicity. So I mentioned before, be very careful with these with patients with renal insufficiency, cramping, diarrhea, increased thirst. Cramping and diarrhea are normal side effects. Magnesium toxicity is not a good thing to have. And obviously you can get dehydrated, so you're thirsty. The stimulants, the one thing to remember is that your Senecot can cause your urine to be yellow-brown. That's very normal. You don't tell them to stop taking it. You just tell them this is a normal part. It's just part of how the medication is made, and don't stop taking it. These types of medications can cause some irritation again, because if you're going frequently, it'll cause some rectal irritation. Rash is rare. Nutrient malabsorption can happen with all of these medicines except for the bulk forming. Okay. All laxatives can cause electrolyte imbalances, but remember your Metamucil is really not a laxative, so that's like it's a bulk forming laxative, but it's rare that it would cause an electrolyte imbalance. The rest of them, yes, can. Watch for children and elderly, and its normal reflex to defecate. The normal reflex to defecate can be inhibited with overuse of laxatives. So in another term, if you're using, in other words, if you're using it chronically, the normal reflex to have a bowel movement can be inhibited. So it may not work anymore or function. So if you're using chronic laxative, these are people that have serious issues with normal defecation because they're overusing the laxative so much your body gets used to it. You obviously want to make sure that you're getting your history, making sure they're not dehydrated before, check their renal status, and if they're having any other symptoms like nausea, vomiting, abdominal pain, you really don't want to give a laxative or any medication for that because there could be something underlying. High fiber diet is always recommended. Increase fluid intake as an alternative to laxative use because if possible, you kind of want to avoid medications if you can, other than for pre-surgical prep and things like that. Long-term use can result in dependency, which I mentioned you can have that issue with not losing that tone. All laxatives should be swallowed whole, not crushed or chewed, especially if enteric coated. They should take all laxatives with 6 to 8 ounces of water. And remember, like your Metamucil, your bulk forming, they always should take it with a full glass of water. Hint, hint. Your laxatives, the bisacodyl and cascara, should be given with water because it can interact with milk and acids and H2 blockers. Remember those, your Pepcid, your Tagamet, and your Zantac. If you have any abdominal pain, that severe muscle weakness, cramps, dizziness, you have to think underlying. If someone's saying that, what could be happening? They could be dehydrated. So what are you going to do? Contact the provider because they could be dehydrated. And of course, you're going to make sure and see if it's working. So these are real important slides, examples of who may need laxatives. Someone that's recovering from cardiac surgery or any vascular type surgery, because you do not want them bearing down because you've just done surgery on their whole vasculature system or on a part of it. You don't want them bearing down. That could rupture something, not good. Colonoscopy preparation, any other type of surgery, which you talked about, like female surgeries, bowel surgeries. After childbirth, they may need some because you don't want to be straining. Number one, you're in pain. Number two, many times with childbirth, you'll have hemorrhoids, so you want to avoid constipation. Chronic narcotic therapy, hemorrhoids. A hemorrhoid treatment is saying you should be taking some bulk forming laxatives on a daily basis if you have hemorrhoids. That was going to help because you don't want, because that's what hemorrhoids are, is basically putting pressure on the rectal area, and those veins it's under too much pressure. So then they form a bulge, which is your hemorrhoid, and they can rupture. So keeping that stool going nicely through the bowel and through the rectal area is what's going to help prevent flare-ups. Remember, laxatives are used for correcting constipation. All right? It's not preventing, it's correcting. All right, here's that gallon of PEG stuff that people take for colonoscopies. I'm not 50 yet, and I always said they better come up with something different prior to 50 because I'm not having a colonoscopy. I'm one of those typical healthcare providers. And luckily they have now. So forget this stuff. I'm not taking that. Yuck. I've seen it too much in the hospital. All right. I'm not being a very good teacher, am I? Laxatives contraindicated. Do not take laxatives with any type of abdominal pain. Because why? Something's underlying. It could be diverticulitis. What's diverticulitis? It usually is in the left lower quadrant of the colon. And there are little pockets that develop from poor diet, or it can be genetic, but those pockets can end up becoming infected. I don't know if you've heard in the past, like don't have seeds, popcorn, that kind of thing. There's two schools of thought with that. It's always been avoid seeds, avoid popcorn, to help prevent the seeds and all that from getting into the pockets. But now the new recommendations are you can have whatever you want, but just make sure you're eating fiber and you're drinking a lot of water to keep things going through. And a bowel obstruction obviously would be contraindicated with that because that could be something serious. So in addition, to add to the surgery and stool softeners, laxatives, please, this slide's really important also. Patients are often taking opioids, so they need a softener. So let's say somebody just had surgery and they're taking Vicodin or Percocet post-op. So you're worried about them having constipation. So a good choice is the Colace type medications. That's the best choice over other types of laxatives. We already talked about straining. We already talked about cleaning out before surgery. And Dulcolax, there's another example of Dulcolax, which is real good to take prior to surgery because it acts within 6 to 12 hours, so you take it the night before. So if someone needs to be on that, you take it the night before, you wake up in the morning, and then you should have good results. What if you have occasional constipation? Well, this is where the bulk-forming laxatives are best. That's the Metamucil. They're safe to take with diverticulosis or itis. You can take long-term. It should not cause severe diarrhea, but remember to take it with a full glass of water.